Good afternoon. I'm Dr. Linda Scott, Dean of the University of Wisconsin-Madison School of Nursing. Thank you for joining us for the 24th Littlefield Lecture Series. This lecture was established in 2000 to honor Dr. Vivian Littlefield, a Merit Dean and Professor of Nursing at the time of her retirement, having served as Dean from 1984 to 1999. She was highly regarded for her dedication to mentorship, vision for the role of nurses as leaders, and passion for advancing social justice. This is the first Littlefield lecture since Vivian passed away last August. While she is missed and thought of fondly, I am grateful that I had the opportunity to discuss our plans for the 24th lecture with her last spring. Vivian was proud for the topic of building equity in maternal care and delighted that our chosen speaker, U.S. Representative Lauren Underwood, accepted our invitation to join us. Building health equity is an area where nursing education can lead change through research, teaching, learning, care delivery, and encouraging advocacy for health. As a School of Nursing now celebrating its 100th year, we often talk about our legacy of leadership. Our history is full of moments where Badger nurses have innovated, advocated, broken barriers, and led change to meet the health care needs of their time. Finding new avenues to improve, protect, and promote health is what unites us through the years and eras of our first century. It is what fuels the progress we are making now. And it will be the key to transforming the future in our next century. The perspective and advocacy of nurses is critical to building health and equity. Nurses are often positioned to identify barriers and develop new knowledge, outreach, policies, or processes to address them. For some, the desire to address root determinants and implement interventions to improve health and well-being leads them to direct their expertise to governmental policymaking. Today, I am honored to host a discussion with United States Representative Underwood about nurse leadership and healthcare policy, especially as it relates to building equity in maternal care and health outcomes. We only have a short time, yet a breadth of topics to cover. We'll begin our conversation on some established topics, incorporating themes that emerged from our audience at the point of registration for this event. I do want to thank all of those who have included topics of interest when you signed up for this event. These submitted questions and themes will take the place of an open chat feature, which can often be distracting. So without further delay, I would like to introduce Congresswoman Underwood and let our conversation begin. Since being sworn into office in January 2019, Congresswoman Lauren Underwood has represented and served the 14th Congressional District of Illinois in the United States House of Representatives. Representative Underwood is the first woman, the first person of color, and the first millennial to represent her community in Congress. It is relevant to today's conversation that she is the co-founder and co-chair of the Black Maternal Health Caucus, which addresses America's Black maternal health crisis in Congress. This caucus advances policy solutions to improve maternal health outcomes and to end disparities. Prior to her election to Congress, Representative Underwood served as a senior advisor at the U.S. Department of Health and Human Services. As a career public servant at HHS, she also helped to implement the Affordable Care Act, broadening access for those on Medicare, improving healthcare quality, and reforming private insurance. And I am especially proud to note that Representative Underwood is also a registered nurse. I hope that members of our audience will take note of that and let themselves be inspired to answer the call to public service in this capacity should their professional journey and personal conviction lead them to consider it. Representative Underwood, welcome to the virtual stage and thank you for joining us for this conversation. I also want to thank you and your staff for your willingness to reschedule this important conversation from last fall. It is a truly our pleasure to have you with us today.
Hi, Dr. Scott. Thanks so much for having me. Really appreciate it.
Okay, well, and we're excited, and I think I'm just going to go ahead and dive into our conversation. As I mentioned in your introduction, you're the youngest millennial in Congress. Could you share your path towards governmental policymaking and how that emerged?
Sure. My story really starts when I was in elementary school. I got diagnosed with a heart condition and decided to become a nurse because of the great care that I received from my providers. And my second semester freshman year at the University of Michigan, I took a policy and politics class in the honors program. And that was the first time I ever heard the phrase health policy and, became aware that I could do this work as a career. And so I was put onto my path really early on in my nursing education, and spent summers while in college interning on Capitol Hill. I worked for then Senator Obama, and then I worked at the Centers for Disease Control and Prevention in Atlanta. And when I graduated, went straight into a master's program at Hopkins, a joint master's in nursing and public health, and then served at Health and Human Services, working to implement the Affordable Care Act, and then later part of the Obama administration, working on public health emergencies and disasters. I decided to run for Congress because, in the spring of 17, after President Trump took office, there was, an effort afoot to repeal the Affordable Care Act, and my congressman had made some promises around protecting healthcare coverage for people like me who had pre-existing conditions. And I believed his promise, and then when he broke his word, I felt betrayed and decided to run against him. And I jumped into a primary facing 6 guys, and I won that primary with 57% of the vote. And then in November of 2018, I beat that 4-term Tea Party Republican congressman by 5 points and became the youngest Black woman ever elected to the Congress. And now I'm one of just 3 nurses in Congress, and I work to ensure that the policies that we advance are evidence-based and that they're data-driven. And a lot of my work is really focused on growing and diversifying our nursing workforce. There are so many policy issues that impact our profession, and want to make sure that we have robust support for our education. Nurses are different in the way that we're educated than physicians, in that, the taxpayers aren't really investing in our education so much. And so there's so many nurses graduating with considerable amount of debt. It ends up being a disincentive for people to enter into the nursing workforce because of that lack of affordability. And so we have legislation to address that, legislation to support the National Institute for Nursing Research. We're really interested in supporting our advanced practice nurses, and so that they can practice to the full extent of their education and training. I mean, so much more. And so we have a really robust nursing agenda that we're working to advance in a bipartisan way. You mentioned the Black Maternal Health Caucus, which I was proud to co-found and co-chair in 2019. One of my good girlfriends from my time at Hopkins was a woman named Dr. Shalon Irving. She had already earned a PhD when she entered our master's program, and but she just wanted more education. And when she graduated, she went on to serve in the United States Commission Corps, the public health service. I'm sure you guys are familiar with it. And when I was wrapping up my time in the Obama administration, she was giving birth to a beautiful baby girl named Soleil. And a couple weeks after she delivered her daughter, she died due to complications related to high blood pressure. And Shalon's death really inspired me to tackle maternal mortality while we're in Congress, and been doing that work throughout my time to push forward a comprehensive piece of legislation called the Momnibus. So between my nursing efforts and our work on maternal health, we have been, really laser focused on advancing this robust healthcare agenda, and I'm delighted to share more with you today.
Well, and we are really interested in hearing more about it, but there was a lot of what you just told us in your background that I want to unpack.
Okay.
Well, one, even just starting what the influence of your nursing education,
Yes,
a number of times when people sort of see shifts in their career, they don't think that they're a nurse anymore. But can you talk about, yes. So can you talk about your thoughts about that and how you use what you learned in your nursing education program to inform your work now in the political arena?
Sure. So, I consider what I do now to be an extension of my nursing career. We're helping to take care of the whole country by making healthcare more affordable for the American people, by working to end health disparities and make sure that we're advancing evidence-based policies to tackle diseases and to, just make sure that we're solving longstanding challenges across the country. I certainly had a non-traditional nursing career from the very beginning. And so I'm used to defying expectations. My clinical faculty were sometimes challenged to find opportunities that really fit my unique needs. I remember in my BSN program, we had like a transitions clinical in the last semester, and I did discharge planning because that was the most unique clinical placement that they could come up with that was close enough to public health and health policy that fit sort of the requirements. But I would just say, our clinical training and our education really makes us qualified to be decision makers, makes us qualified to consider complex information and to advance changes, public health and policy changes to benefit populations and communities that we serve. And even if nurses haven't traditionally served in these roles, does not mean that we are not qualified. And so what I do is I take, my clinical background, understanding, diseases and the health system, making sure that I understand, disparities, and translate that for a lot of my colleagues. I'm able to view, articles in biomedical journals and turn that right into legislation that ends up getting signed into law. And really, very comfortable in community settings, regardless of income level or how raw and real they may be, to really figure out how we can work collaboratively to solve problems, right? Like I'm willing to go into those underserved communities to really tackle challenges. And I think my nursing education, particularly as a public health nurse, has prepared me to do that quite well.
Yes. So nursing process and clinical judgment and evidence-based practice, those aren't just hoops that we have our students go through. They're really tools that you continue to use in your work today.
And I think that so many nurses come to policy at the end of their career where they're really able to see the connections between the work that's done in the clinic or at the bedside and the decisions that are being made by policymakers, either in their state capitals, at City Hall, or in the United States Congress. What I've done is I've just front-loaded that awareness and really developed a set of experiences that allow me to be effective on Capitol Hill as a congresswoman in my 30s, right? And so I would just invite people to examine the ways that policies are impacting the work that you do, and then to start to envision yourselves as a policymaker, whether you're serving on an oversight board over your local health department, or whether you get an appointment by your governor to tackle important issues in your community, right? There's things that you can do while you're still maintaining your clinical practice to prepare you for an eventual decision-making role.
Sure. Well, and you mentioned this, some of the most pronounced and pressing areas of disparity in healthcare are related to maternal health, specifically the disproportionately negative outcomes in Black maternal health in the United States. So to help us establish a shared understanding of this part of our conversation, I'd appreciate it if you would describe the significance of America's Black maternal health crisis and why it begs our attention.
Yes, ma'am. So in the United States, Black birthing people are 3 to 4 times more likely to die of pregnancy-related complications than their white counterparts. This is a disparity that's existed in our country for decades. It's tragic and it's unacceptable. We also know that because of this disparity, the United States leads the industrialized world in maternal deaths. And so our maternal mortality rate is far higher than so many of our peers. And so we also know that 80% of the deaths are preventable. So we have this phenomenon of one group of people, Black moms, being more likely to die. 80% of the deaths are preventable. And it's leading to, overall very poor maternal health outcomes across the board in this country. We see this manifested in this common thread in our Black community where we all know someone. It's like a sorority of sorts. We all know someone who's been touched by this crisis of death or what we call near misses, severe morbidity. And it ends up being our sisters or neighbors, our best friends, or our church mates, or whoever, right? Like, we all just know people who've been impacted, and it's been allowed to continue, right? Like, prior to our introducing the Momnibus in 2020, there had never been a comprehensive federal initiative to address our nation's maternal health crisis and the disparities that we see in the Black community. I think this is long overdue.
Mhm. And it also spans physical health status, financial well-being.
Absolutely.
It touches every one of us. And thank you for sharing your own personal experience with this too, that serves as an inspiration for you to continue this work.
Yes, ma'am. So as Dr. Scott mentioned, it doesn't matter if you are being a Serena Williams or Beyonce Knowles or a woman in a neighborhood, a low-income neighborhood here in Washington, D.C. This crisis touches all of us. Why? Because the protective factors like income, education, whether or not you have health insurance, whether or not you got prenatal care, right? Like, those things are not protected for Black moms. They don't protect Black moms from what underlies the maternal health crisis in the United States, which is racism within our healthcare system. And so we acknowledge that fact and have created a data-driven, evidence-based, comprehensive policy solution called the Black Maternal Health Momnibus Act. It combines two words, moms, and a legislative term called omnibus. And an omnibus just means big legislative package. And so it's a big legislative package for moms. It's now 13 bills to address every clinical and non-clinical driver of the nation's maternal health crisis. The Medicaid expansion, the postpartum Medicaid expansion, is not in the Momnibus, but we are very supportive. And we're just working hard to get it signed into law.
Okay. So what provisions have advanced to action, if any?
Right. So within the Momnibus, our legislation to support veteran moms, the Protecting Moms Who Served Act, has been signed into law. You may have seen some news reports over the last couple of weeks. There's been a federal study that we commissioned as part of that new law to examine the disparities within the VA, which are significant. Black moms are most impacted by severe morbidity, even within the VA, a single-payer healthcare system from a government-backed program. The disparities persist. And then 80% of the rest of the Momnibus passed out of the House last Congress. Now, you all know Schoolhouse Rock, how a bill becomes a law. And so you know that at the end of a Congress, if a piece of legislation doesn't get signed into law, you have to start over again. So we had to start over in January of 23. And so we're working through this legislative process once again to get the full Momnibus enacted. But in the meantime, we've gotten a lot of money. So over $100 million in Momnibus related funding has been signed into law, even without having, the president of the United States sign the actual legislation. And so those dollars are flowing to community-based organizations. They're flowing to historically Black colleges and universities. They're flowing to healthcare providers around the country, mostly funded by HRSA, the Health Resources and Services Administration. But we're really proud that those resources have now come online.
That's wonderful. The Momnibus Act also spoke to the need to grow and diversify the maternal health workforce. Can you share some thoughts about this need and its relationship to maternal health outcomes?
Yes. So we call it the perinatal workforce, recognizing the need to have more OBs and more midwives and more nurse midwives, more lactation consultants, and more doulas. Why? We need to both grow that workforce. We shouldn't have the severe disparities that we see around the country in terms of lack of access to qualified health providers, obstetric and maternity care providers, postpartum providers, and then maternal mental health providers as well. And then also, we need to have more people of color, more people speaking languages that are congruent with the communities that they serve. Why? Because the data tells us that the outcomes are better when we have moms with a choice in their providers. And so we believe in 2024 that it shouldn't just be a mom who's delivering in the shadows of an academic medical center that has an option to have a doula. It shouldn't just be a mom that lives in an urban area that has the option of a midwife. That we believe that rural healthcare should be the highest quality care that we can receive in the country, and that moms, no matter where they live, because rural doesn't mean white, right? We know this, that no matter where she lives, she should be able to pick a provider of her choice that will be able to speak the same language and understand her lived experiences.
Yes, so true. And the data supports that. And now it's just making it happen, And
yes, ma'am.
Yes. So with that being said, we know that nurses are the most trusted profession.
Yes.
Yet there is still mistrust and fear among individuals seeking care, which negatively impacts the outcomes in maternal care and overall health. Any thoughts about how we can rectify that situation? Trust and mistrust. How can we really help this population?
At the end of the day, as a nurse, our responsibility, when we think about, the foundational documents, those documents that we got first semester at nursing school, our code of ethics speaks to our responsibility foremost to our patients and the clients that we serve. And so when I hear reports about, in the states that, for example, have advanced abortion bans, and it's the nurse that call the police, right? Like that is where we see sort of these breakdowns in trust. We are very fortunate and blessed to be able to care for people in some of their most vulnerable moments. And we have to maintain that confidence that people place in us, even in an environment where we know that there's distrust in the larger healthcare system, where we might be in a really litigious environment, where we might be in an environment where, there's, a lot of swirling questions about ethics and morality. We have to continue to make our North Star our duty to that patient. And I think that sometimes we don't have the incentives to do that in all of our workplaces, but we are professionals. And we have the responsibility to make choices on our own. And I would just encourage nurses to remember why we're here and who we're serving.
Sure. Well, Representative Underwood, our viewers include hundreds of people who are either nurses or who are supporters of nursing. Several submitted questions reflecting a strong interest in contributing to health equity and being champions for promoting health, whether it's directly in their own professional roles or through service in other ways. So from your perspective, how can we better harness the unique knowledge of nurses in general, those in advanced practice, to identify systemic solutions to disparities and adverse outcomes?
Yes. So I think that what happens oftentimes is nurses only seek opportunities when they're explicitly called out as looking for a nurse. Meaning, if there's grant funding, that may be a generalist announcement, we're not necessarily applying for that funding if it's not flowing through like NINR or through a school of nursing. We're not applying for jobs that might be generalist type positions unless it's explicitly seeking an RN or someone with an advanced practice degree. And I think that that is a mistake because we are more than qualified to contribute more broadly. And I think that we will not see the advancements in health equity until we are more prevalent at decision-making tables. And so I would just encourage all of us to think expansively about the impact that we can have and the work that we do. And even if it's not explicitly called out that they're looking for a nurse, just assume that they are and know for yourself that you are more than qualified to do this work.
So whether in legislation, professionally, or in our civic and personal lives, how can we separate the idea of equity from politics?
Oh, separate it from politics?
Yeah, is it separable?
Well, listen, I was a faculty at Georgetown for a number of years teaching a program about policy to graduate nursing students. And they were so upset because they're like, why do I need to take this class? I'm trying to be, a CRNA, and this is not relevant. We can't be afraid of politics. Everything's political. And there are people who are making decisions about our scope of practice. There are people making decisions about the meds that we can prescribe and administer. There are people making decisions about how long our patients can stay in our units. There are people making decisions about what our education looks like and whether or not we qualify for licensure. There's people making decisions who are not qualified. And yet we're sitting here talking about, oh my God, I don't like politics. I'm apolitical. Listen, we need you to be political. And we need you to remember, again, why we're here and who we're here to serve. And even if that kind of partisan politics is challenging for us, in that maybe the team that's on the side of nurses, or maybe the team that's on the side of our patients, is not the team that you vote for, that's okay. It's okay. No one's asking you to take on a whole new identity. But what we are asking you to do is not opt out. This is political. People are dying, and it is unacceptable. And we cannot keep looking away because it makes us uncomfortable to engage in politics.
Yeah, and I think that's also where we struggle in trying to make sure that our current nurses and future nurses need to be more visible, more vocal, more proactive in their advocacy, whether it's in their research, their practice, education, policy, or elsewhere. How we really encourage individuals to do that. So oftentimes when the focus of nursing in these conversations fails to include the role of research and scholarly work in reducing barriers to health. I think we need to be able also to speak to how innovative, inclusive research, clinical scholarship, evidence-based practice can really truly inform evidence-based policymaking.
Yes, ma'am.
Your thoughts about, you were very passionate about that, and I want to make sure that that's part of our take-home message today,
yes,
that we cannot be silent.
We need people to understand that they have a professional responsibility, even if it makes them uncomfortable. And the more they do it, the more comfortable they'll be. They will speak with the same kind of passion and conviction that I have today. And they will be confident in asserting their own opinions about what the future of our healthcare system looks like, what the future of our communities look like. If we proclaim that we're about the health and well-being of the American people, if we proclaim that we're about advancing evidence-based practice, and yet we serve in states or communities where they're actively, minimizing the role of scientists and researchers, they're denying facts and truth, then those things don't really square. And we have an opportunity to be a bridge to the public. Why? Because we're trusted and people enjoy interacting with us, and we can help make the changes that we know are needed throughout our society.
Mm-hmm. Well, you mentioned earlier about scope of practice and
yes.
full practice authority. And
Mm-hmm.
we know that there's only 27 states where advanced practice nurses have full practice authority. We're hoping that Wisconsin will be number 28. It's sitting on the governor's desk, so we hope that it will actually go into law. How, again, can we encourage the pursuit of graduate education, the advancement of within the nursing education scope for more advanced practice nurses, more doctorally prepared nurses, and encourage full practice authority for them to really engage in the practice and the access to care that our citizens need?
Well, I do think that part of this seems to be, some fracturing within the larger nursing community, where by and large, it's just the APRNs that are advocating for APRNs. I think that is kind of a weakness in our strategy. And I would encourage folks to really have a more global viewpoint on what it means to advance opportunity for nurses at large, and to be comfortable and willing to be advocates. And, even if you have to take a personal day or vacation time to travel to your state capital for a nursing day of action, you should do that. I, really support the efforts to incorporate this type of advocacy training in nursing education at all levels, so that people understand what it means to be a voice. And I think that, we will continue to make progress to expand a scope of practice for APRNs, if for no other reason than dollars and cents. It just, we're in an environment where we have the largest group of retirees ever, right? Like our seniors, the baby boomers, there's more of them than there's ever been demographically. And we have to have more providers to care for our aging Americans. And, due to some restrictive immigration policies, we're not going to be able to have that immigrant workforce care for them 100%, which means we need more nurses. And that's sort of no matter what viewpoint someone takes in terms of their partisan identity, I think that this is an issue that people of all backgrounds can get behind, but they won't if we don't ask them for their support. And so I think what's key is that we need to be louder, more forceful, more consistent in our advocacy. And there's an opportunity to weigh in right now at the VA. And so I would invite everybody to go ahead and do that. The CRNAs need to have full practice authority at the VA, and we're working hard to help convince the administration to take action.
Right. And you also mentioned rural. So when we think about rural healthcare needs versus metropolitan, how much do the root causes of rural versus metropolitan health disparities have in common, and what are some of the overlapping potential solutions?
Well, I think that, there's just some challenges in terms of our current healthcare system, which rewards volume. Our current healthcare system, which, the more people you can pack into an hour, the more you can bill to insurance, the more money is made for that healthcare system, and the consolidation that we see in our healthcare system, meaning, large healthcare systems buying up small medical practices, buying up small community hospitals, and then closing those institutions when they don't hit their revenue goals, right? We're seeing this happen in the 14th Congressional District in Illinois that I represent. I know it's happening across Wisconsin. I know it's happening around the country. And so those are kind of unique factors to what's happening in our rural areas. Workforce, trying to recruit and retain high caliber quality nurses and other healthcare providers is a challenge across the board. It's a very competitive environment for our clinicians, and clinicians have a choice on where they work. And oftentimes rural remote communities just are not as competitive. So I think that there are some specific concerns to rural health. What I don't believe is the solution is telehealth, right? Like we know that telehealth opportunities can help be a bridge, but they don't replace in-person interactions. They don't replace care being available in your community. And so I think we have to be really focused as nurse advocates and uplifting evidence-based interventions. And we know that telehealth is not always an evidence-based intervention. So you don't hear a telehealth conversation in the same way when you talk about like urban health issues, because we know that urban can somehow be a code word for like Black. We know that to address health disparities for certain populations, telehealth is just not it, right? So I would just say like, let's let the data, the science, the evidence guide us. And let's be willing to invest in healthcare solutions for all communities.
Mm-hmm. And I think we're seeing a lot of, again, closures of community hospitals that originally provided maternity care, and now they've closed those, and so there's limited access to the maternal population.
That's right.
So we have a few more conversations or questions from our audience, one of which was about the role of innovative partnerships for health promotion to build equity. For example, is there potential for collaborations across health entities and agencies or other public services, such as schools, to reach more people to promote health and well-being?
There are opportunities for collaboration. Sometimes we're even going to pay you to do it. So let's go. We're really excited to be able to pull in the expertise from a multidisciplinary team in order to advance health outcomes. There's certainly innovative, what we call bundled payments, so that, there's a financial incentive to work together. And I would just say, like, let's think outside of the box and be willing to learn from one another.
Mm-hmm. Yes.
I think it's really important.
Right. Yes, wonderful. And, we also think about how we can collaborate versus being in competition.
Correct.
And so really knowing who are the recipients of our care and advocacy, and it's not who needs to position themselves in a different place.
That's right.
Mm-hmm. Yes.
Yeah, let's have an abundance mindset. Mm-hmm. There's enough for everybody here.
Yes. Instead of coming from a competitive deficit model. Mm-hmm. Yes. So this question was posed by a number of our registrants. is it known, or can you speculate on the impact that greater or universal access to healthcare would have on maternal health in general and in addressing some disparities?
Yes. So access to care, meaning physical proximity to a healthcare provider, meaning ability to afford healthcare, both influence maternal health outcomes. I think this person was asking about transitioning to a single payer healthcare system and would that improve maternal health outcomes. And I would just encourage people to take a look at what's happening in other what we would consider to be single payer healthcare systems domestically, right? And we see disparities within Medicare, significant race-based disparities in Medicare. We see significant race-based disparities within the VA, and we see considerable disparities within our DoD healthcare system for our service members. And so, while we certainly want to get to universal coverage, let's not pretend that that is the solution to address racism within our healthcare system. It's just solving for a different problem. And so while we can do multiple things and we can certainly work towards multiple goals, I just don't want people to think that, all of a sudden we're going to have everybody with, let's even call it free healthcare, and that solves the problem. It does not. And obviously we know that single payer healthcare is not free.
Yeah. So while many solutions to mitigate health disparities will need legislative policy to be meaningfully addressed, what can every nurse or healthcare professional do at the individual level to contribute to more equitable healthcare?
Okay, so what we need you to do is, one, decide to be part of the solution. You have to make a decision. No one's going to make that decision for you. But once you make that decision, you can allocate your time as an advocate. You can reach out to policymakers. You can reach out to your city council, your county board. When you see things that are inequitable locally, you can reach out to your mayor. You can reach out to your governor. You can solicit. You can submit a resume and ask to receive an appointment for a commission that works on healthcare issues or climate issues or, transit issues. If you believe in public transit and you want to, help people be safe in navigating our communities, right? Because we know that injuries are a leading cause of death for some demographic groups. Just decide to be involved. You don't have to quit your job and run for Congress like I did, but we would invite you to do that, right? Like, we need more nurses on Capitol Hill. But don't think that you need to go to law school. You don't. Don't think that you need to make a hard pivot outside of your career. You don't. But I think that we have to be involved. And certainly we need to be voting. Certainly. We need to do that in every election. And we need to feel comfortable raising our voices in policy spaces, whether it's testifying in your legislature, writing a letter or an email to your elected official, asking for a meeting. Most people don't do that. And I love meeting with especially people who have expertise and I can learn from them. Like, let's do it. I mean, I'm not saying you all need to ask to meet with me, okay? Because sometimes when I say that, we get inundated. I'm saying ask to meet with your representative. And, make sure that you're building those relationships where they count on and trust your counsel.
Thank you for that. It's nearing time for us to wrap up, but I have a couple more questions that I'd like to pose with you. And then I'd like to end by providing an opportunity for further influence and inspiration. As you know, nurses have a unique perspective on health barriers and solutions. I invite you to provide our viewers, many again who are early career or future nurses, with a message of encouragement for those who are hesitant or unsure of their potential for impact by engaging in policy. And you've gone there some, but I want to give you an opportunity again to solidify that take-home message about their engagement.
Well, I would just say, again, that we have a professional responsibility to do this work. Some nurses understand that responsibility late in their careers. And as a result, we aren't always maximizing our time to make our voices heard. I would invite you to get started now, to do it with confidence, even if it's not familiar to you. There are a bunch of nurses in these spaces that are waiting for you to show up. Okay, we're here, we're waiting for you, and we're looking forward to working with you to get this done. And I would just invite you to imagine what a more just and equitable society looks like, and think about what you are willing to do to make it happen.
Which also brings me to the last one, which is about an opportunity for you to paint us a picture of what the overall positive impact to society would be when greater equity in maternal health and overall well-being is achieved. In other words, what is the vision and impact of equity that inspires you?
Well, I imagine an opportunity to comprehensively address this issue, and to make sure that we're tackling social determinants of health, that we're tackling workforce issues, that we're supporting the credible, trusted community-based groups on the ground, that we're embracing technological solutions and seeding investments for the future, that we are, investing in data collection, and all those things are part of the omnibus bill. And I'm really looking forward to making sure that the resources are flowing to every corner of the United States to improve maternal health. I also am really excited that visionary leaders like you, Dr. Scott, are having these conversations in schools of nursing, because so often, we as nurses don't see ourselves as being sort of like pace setters, to set that like ambitious new goal, to see that horizon and like run towards it. But your leadership allows this to happen. And I'm really grateful that you've created space for us to have this conversation today. I want to see more of this in schools all across the state and across the country. And so that this next generation of nurse leaders understands what we are here to do. It's not just excellent clinical care. It's not just tremendous institutional leadership, but it's really working towards a vision for our profession and for our communities that is more inclusive and more just and more equitable.
Well, Representative Underwood, we really appreciate you taking time out to be with us. We know that you have an incredible busy schedule, and even sharing this time with us, I know has been helpful for us, and I hope it's also been inspiring for you to spend time with us. We really appreciate your insight and perspective on the role of nurses in building equity in healthcare. It's been my pleasure to host this conversation, and I always appreciate your leadership as a legislator, nurse colleague, and an advocate for advancing equity and improving health for all people. So thank you again for being with us.
Thank you.
Take care.
Bye.
Bye. So before I close, I would like to thank the Friends of Littlefield for conceiving and supporting this lecture series. It is a gift to the school, alumni, friends, and many of our partners. I would also like to thank our audience members for joining us and providing thoughtful questions. I hope you have been inspired by the conversation. As a reminder, we will have this recording archived and posted next Monday on our Littlefield Lectures events page. We will email a link to all who were registered. And I am very excited to announce that the next Littlefield leadership lecture, the milestone 25th in the series, will take place on Friday, November 8th. In fact, the Littlefield lecture will be a part of our signature centennial event that will take place that evening. That will kick off our centennial weekend. On Saturday, November 9th, we'll hold an all-school reunion in Cooper Hall. Our all-school reunion will be a fun opportunity to socialize and reconnect. We truly hope all of our alumni and friends will join us that weekend. Together, we will celebrate what unites us as Badger nurses across the professional and life paths that we have taken, graduation years, and errors. So more information will be shared about the weekend and other centennial programming in the coming months. For now, thank you for joining us. And as always, on Wisconsin.